Welcome to the Career Conversations panel with Kinesiology and Health Sciences grads. My name is Liz Cook, and I'm Employer and Alumni Liaison at the Career Center. I'd like to introduce our panelists.
So I work at Humber Hospital, which is a general regional hospital in the area. It's actually down the road at Jane and Finch, and at Church Street site, which is just down Jane near the 401. I've been in the role for 5 years. I graduated York in 2004. When I was at York, I did my kin degree, but I also played football with the football team here, which has helped with some networking in the past number of years, and I remain friends with all those. I'm the Occupational Health and Safety Specialist. What this means is I train all workers. Train is not the right word. I educate them, create awareness. I'm trying to prevent them from being injured. And so the way I got into this field, my background's in kin and then ergonomics, and so the ergonomics, as I got into my job now, my main role is to prevent injuries, and how that works is through assessment, as well as getting an incident report and doing an investigation. And there's various ways you can combat injuries at a hospital. Right now in hospitals, the biggest problem is musculoskeletal disorders. Nurses like to injure their backs when lifting patients, and they don't like to ask for help. So it's my job is try to change culture, change how they do things, and try to develop the safety culture in a way that we reduce injuries, thus reducing costs, thus paying for myself and other people's salaries. So that's the idea.
Hi, my name is Dr. Anthony Testa. I'm a chiropractor, and I've been one since 2009. I initially didn't start out as a chiropractor. I have 2 degrees from York. First, I have a degree in kinesiology. I graduated in 2004 with Neil. And then in 2005, I actually got a degree in education from York, so I was a teacher. I had applied to chiropractic college, was subsequently accepted, and I never looked back. So it's been fantastic. I love what I do. I don't know if anyone knows what a chiropractor does, but one of the things we do is, so when Neil's dealing with some employees that have been injured, some of them go on WSIB. I happen to deal with WSIB, so while they're hurt, I make them better, and then Neil implements the work for them to not get re-injured. And then also some of what I do is when people get into car accidents, I also manage their file, and I would deal with one of the alumni to the far left, and we would discuss what would happen moving forward for the patient. But the key to what I do is to help people, help get rid of pain, rehabilitate them to get stronger, and to get them back into the workforce. I'm also an acupuncturist. I don't know if there's been some changes. Acupuncture is now a regulated health profession in the province of Ontario. So I'm also a regulated acupuncturist, so I do both, which is, in what I do is wonderful with chiropractic using my hands and acupuncturist using the needles. I very often deal with many medical specialists, physiotherapists, massage therapists. Chiropractor, if I had to say in the health field, is like a jack of all trades. We have to do a little bit of everything. As you see here, Precision Health and Wellness, that's my own clinic. So as a chiropractor, not only am I responsible for the professional side to treat and to make people better, but also there's the business side of that, right? So I have to cut checks for my employees, manage bills. So it's nonstop. So I don't have set work hours, but I'm always working. So that's something that you like. You're a chiropractor.
I have 2 careers currently. I work in a cardiac rehab clinic, and I'm also a paramedic in the region of Peel. When I was in school here at York, I took a course called Psychology of Heart Diseases, and that was sort of what got me into the cardiac rehab path. So I went and pursued that career. I became a volunteer in a cardiac rehab clinic in the hospital near my house, and then got hired there before I graduated, which was really nice. And then once I graduated, became full-time and all that kind of stuff. From there, I went into college and I did the paramedic program. And when I finished that, I got hired in Peel Region and am working both jobs subsequently, which is kind of nice.
By profession, I'm accident benefit claim adjuster, so I adjudicate claims and deal with injury portion, investigation. My job kind of includes Deal with all different kind of departments, so that includes SIU, we deal with medical sides, we deal with different health professionals, psychologists, chiropractic treatment. We receive treatment plan on day-to-day basis from various health professionals. We assess them, and then based on that, we set our reserves to see that how much this claim is worth. In terms of education, I started out as I completed my diploma from Sheridan College in pharmacy technician. I worked in the hospital for I think 5 to 6 months, and then I was just looking for a job to kind of pay my student loan. That was my first thing, just get a job, start working. I came across a sales job in insurance field, so I said, okay, it's not bad, the benefits are good, pay is good, let's start. And then that's how it all started. Insurance companies are very generous in terms of if they see that you have potential, they will pay for your further education. They paid for my further education. There are two biggest professional designations that I have, which are good to have if you're going to work in insurance industry. I have CIP, which is Chartered Insurance Professional, and CRM, which is Canadian Risk Management from University of Toronto.
I'd like each of you to talk about what a typical day might look like for you.
So my day-to-day task, I have to go through reports. That's a major portion. Now, most of the time we call it IME, it's Independent Medical Examination set by insurance companies. We send our clients for examination just to understand that what's their recovery, how much fund we should put aside. And once we receive those reports, we go through that. Depending on what kind of injuries we're assessing, we have to send them for different kind of specialists. That includes psychologists. We get FA, which is Functional Ability Evaluation, done by chiropractic health professional side, or OT, occupational therapist will be doing that. It's called in-home assessment. As well as receiving CNR, so that's clinical notes and records from various doctors. We want to know about that person's medical history. So right before the accident, were they in good health condition? Are there any barriers to their recovery? So those kind of things are also taken into consideration. We do the investigation part for the policy, so we want to make sure that the policy was active before the accident happened. As you know, our insurance rates are really high because there are a lot of fraud cases. So, and not that we are saying that all of them are, but you have to investigate just to make sure that you are not paying a fraudulent claim. Yeah, that's pretty much covers most of my day. We do spend a bit of time in setting reserves up. So setting aside how much money we'll be paying for that. We talk to our lawyers. We have our lawyers who go through mediation and arbitration process, because not always, both parties are in agreement. There are cases where our doctors are saying, no, not really, there are no further treatment required. But lawyer on the other end is mentioning that, yes, they believe that there are more treatment required. In that case, the case goes through arbitration and mediation. So we have our lawyers who discuss file with us. They take us to mediation. And yeah.
So we'll start with cardiac rehab. The first thing that we usually do is we'll start off with exercise classes, and that's typically what we do through the entire day. So the class will come in at the beginning of the day. They'll start with heart rates and blood pressure. So they sit in a circle in the middle of the gym. So it's like a gym. It's got a track around the outside and then equipment in the middle. They'll sit down, they have to sit for 5 minutes. We check their blood pressures and their heart rates before we let them start exercise. We'll do warm up together as a group, we'll do stretching together as a group, and then they can break off into their individual pieces of equipment. So they go on treadmills, they go on bicycles, they do all that kind of stuff. And each patient has an exercise program that's designed specifically for them. So it'll have a target heart rate for them to work at. It'll have a different MET level for them to be working within. So depending on what put them into the clinic to begin with, whether they had strokes, whether they had heart attacks, and any other comorbidities that go along with that. Lots of our patients have diabetes in addition to that, so they'll also have to check their blood sugars while they are in the clinic. Then they'll go and do about 30 minutes of exercise, do a quick cool down. Maybe not a quick cool down, but they'll do a proper cool down. And then we'll do their blood pressures and heart rates again at the end of the day. In addition to just running the exercise classes, we also run information courses for the patients themselves once they're starting in the program. We talk to them about anatomy and physiology, so they get to learn a little bit about their hearts and have a better idea of maybe what was happening to them at the time. And then what else do we do? We also create their exercise programs. So we send them for a stress test, and then once they've done that, they come back and we look at the tests and try to design a program for them. So figure out based on let's say they had a heart attack, and based on the amount of damage that they've had to their heart, we can create a program that would be a safe level for them to exercise at, based on the results that we see from the stress test. So that would be cardiac rehab. As a paramedic, there is no typical day. Every day is a little bit different. They all start the same, so you'll all still start off at your station. You do your vehicle checks. You make sure that all of your equipment's on the truck. Everything is clean and organized, and you have blankets and you have your medications and all that kind of stuff. I am a primary care paramedic, so I'm the first level paramedic at the moment, and you can proceed to an advanced care paramedic, which is typically where it ends. Some other services, like Toronto, for example, has what's called a critical care paramedic, and they have further skills that is very rare. For the most part, the services in the area only have primary and advanced care paramedics. Advanced care paramedics have a few more skills that they can do. For example, they can do things like intubations, they can do IVs, they can give narcotic drugs, those types of things. At my level, it's more symptom relief, so things like epinephrine for allergies. I was going to say asthma, although I can give it for asthma too. Ventolin, Tylenol, Benadryl, Gravol, those kinds of things. In addition to that, I can do defibrillation, I can do CPR, which I'm really good at, and giving oxygen and that type of thing. Typical day, again, doesn't exist, but you would start off on your truck, make sure everything is there. You'd go to book on the air. So if you were getting into your truck to start your day, you'd book on, and dispatch would tell you where they need you to go, if they need you to go to a certain station, or if they need you to go and cover a post, which could be a parking lot somewhere in the region, and just be coverage for that area. From there, you sit basically until you get a call, which can sometimes take 30 seconds, and sometimes it can take 4 hours. Depending on how the day is and how busy everybody is. You might not get a call, you might just be shuffled around throughout the region. If you do get a call, your assessments are always the same at the very beginning. So you start with a primary assessment where you sort of determine what it is that's going on with the patient, and then from there you'll direct your treatment. Patients always go on our stretchers, and we put them in the ambulance, and then we drive them to the hospital. That's pretty much how that goes. And then once we get to the hospital, any number of things could happen. We could get a bed right away. They could have to sit on our stretcher for a very, very long time. We could put them on a wheelchair and send them into the hospital. A very frustrating, I guess, aspect could be that patients think that because they're going by ambulance, that means they get to go straight into the hospital right away. It doesn't work like that. The way that triage levels work is that the more serious you are, regardless of how you got to the hospital, the faster you need to be seen. And that's essentially the way that works.
My days can be very, very different because I can pretty much make my own schedule. So for example, for today, I have two kids, so I had the morning off. I stayed with them, made sure they were good, and then I booked my first patient today for 12. Went in, collected all my faxes, organized them with whatever files they had to go with, and then my first patient came in. And my first patient could be a senior, it could be a shift worker, it could be, I don't know what's going to walk through the door, right? But, and the injuries can go anywhere from absolutely nauseating headaches to as easy as plantar fasciitis from top to bottom. I have to treat them, talk to them. I love what I do. And I'll tell patients that I have them, laid down with some needles in them, and we'll just be having a conversation about sports. And I'll just remind them, yeah, I'm actually working right now, right? So I love what I do. So after I treat patients for a few hours, I set apart some time in my day for some paperwork and for some phone calls, where I will then call accident benefit adjusters just to communicate with some patients that I'm managing that they're representing or that they're dealing with, just to see what we're doing currently and what we're going to do moving forward. I'll talk to other physicians. I'll examine whatever faxes came in regarding some tests that were sent out, and then I'll make notes on what I have to talk to the patient about regarding those results. Then after that time, I'll try to eat some lunch if I can. Then my second batch comes through around 4 o'clock till 7, 8 o'clock, and then at that point I'm jammed. So it seems in my field of work, where some people will take a day off to go see a specialist or to go see their medical doctor. For myself, it's pain that they're okay to deal with, and everyone wants a book after work, right? So for me, in my line of work, it's all after work, so 4 to 8. So in my day, I could be talking to people I have to pay, people who owe the clinic money, other physicians. It's every day, it's something new. It's not easy. And especially when you're in a profession where everyone thinks that healthcare, especially in this province, it's a right, where the realization is if you have back pain, unfortunately, you're going to have to pay for it.
Basically, I'm an office worker for the most part, and my day is 3 parts. First part is the proactive ergonomic side, where I go out and try to prevent injuries from happening. So that's about 30% of my day, and that could be awareness training, that could be doing an assessment with a worker about an office workstation, or in a pharmacy or with a nurse teaching safe lifting practices or safe handling a product. We have chemotherapy, so the whole world around chemotherapy drugs and how it's very unsafe for people, making sure we have all of our safety standards and policies. The other third of my job is after an injury has happened, do we investigate properly, do we put corrective actions out, which manager do I have to go and yell at because they didn't do their job properly, and they put somebody at risk. And my third part of my job is when somebody is injured, getting them back to work on a meaningful return to work job, modified duties, and not allowing them to be home for a long period of time. I'm very lucky. I work with a team of 12 people, and we have a mixture of people in our department, from the insurance side, WSW side, to me as a prevention person. And we actually work with 3 occupational health nurses that deal with occupational health stuff, which is your immunity status, because it's really amazing. Only, let's say 58 or 60% of staff have immunity to measles, mumps, rubella, varicella, all these types of things that we all grew up with getting vaccines for. A lot of our staff don't have access. So they have access, we have lots of access, but they don't have the results. So my job is kind of threefold: investigation of injury. So I'll come into my work, and there's an incident from the night before. Example, a nurse got punched or kicked. And so now it's go out and see what happened. Do they do what they're supposed to be doing? So it's not always what the nurse did wrong or what the worker did wrong. Usually happens is there's a system breakdown. What was the system? The system was supposed to be X, Y, Z, and they ended up skipping Z. And so when they skip Z, all of a sudden, there's a big problem. And so investigate that and just try to work with the staff and make sure that they're comfortable into the workplace and to continue the work. I really enjoy the ergonomic side of it, where you're doing proactive things. You're going out to talk to people who are not injured yet. Why I like that is because they always think they won't be injured. And so you're trying to convince them it's just a matter of time. 50% of nurses are injured throughout their span of their career. So we have 2,400 nurses. 1,200 of them are going to be injured sometime. It's just a matter of how are they going to be able to deal, how can they get inside their heads to say this is important. You don't want to lift even a little old lady, a patient who's 100 pounds, they are a risk. And so when you lift them a lot of times, or how you lift them, will make a difference for your whole career. And so my days broke up in 3. Some days I do more than others. Like today, I sat in my office all day today, audit policy review, which is really exciting. So it all depends what the day is. And so like tomorrow, we're building a new hospital at Keele and Wilson. I'm walking all 15 floors tomorrow to find problems. So I mean that's also one aspect of my job, which I'm really enjoying right now.
How do you take the stress of that kind of job? Do you find it very stressful and nerve-wracking?
It can be. Some days are more stressful than others, obviously, depending on what kind of patients you have and what kind of calls you're doing. It's very, very important to make sure that you sort of have something that you like to do or something that you like to look forward to throughout the week or throughout the day or that kind of thing. I very rarely schedule anything for after a shift because I never know that I'm going to be off on time. You could get a call at 5 minutes before your shift is supposed to end, and there's nobody else there to go on the call for you, so you have to go and do it. And it could take you anywhere from 5 minutes overtime to 25 minutes overtime to 4 hours overtime, or even beyond that. There is no kind of set limit where they say, okay, you've done enough now you get to go home. So that whole work-life balance thing is a really, really important thing to make sure that you try to maintain. I'm enjoying that a lot right now. I'm on maternity leave, so I get a really, really long extended break, which is sort of nice. And I also find that doing multiple jobs is also helpful in that way too. I also work for our base hospital, which is our certifying body. So I go out and I do continuing medical education courses, and I teach paramedics about new drugs that we're getting to use, or new products that are coming out, or that type of thing, or just reviewing basic anatomy, or let's say labor and delivery, which is something that we don't always do.
I think both professions, volunteers or job shadowing for the day or 2 days, that's always available out there. I contacted probably, I don't know how many people, 10, 15 people after I graduated to job shadow them. One was a respiratory therapist, one was an OT, one was an ergonomist, and all these different types of things. And everybody I asked to job shadow for a day, a half a day, everybody said yes.
So is it too early for me, or?
No, I did it after graduation, but I'm sure lots of people do it various times. And I think it's never too early. I've had a lot of volunteers who've come through our program and or our department, and some have caught on with the hospital or other roles, or they realize that this isn't for them, or one or the other, but at least they know.
Absolutely.
I was just going to say when Neil was talking that it's best to find out now if this is where you want to be. It took me a year between college and university to get into my job as a paramedic, and up until that point I was like, I don't know if this is actually where I want to be, or if I just think that it's really fun. And you don't know until you kind of get to do that every day, or you get to see other people doing it every day. And so having the opportunity to actually be out there and doing what you would be doing is extremely valuable, for sure.
I'm not going to lie to you. I'm going to tell you straight, because I would want someone to tell me straight. Starting out is very tough. It's not easy. It's not like back in the day, they used to have a saying, oh, you're going to just hang your shingle, right? Because that's what chiropractors would do. They'd actually work out of their house, they'd hang a shingle in front of their house, and all of a sudden, because OHIP used to cover like $10 or $20 of a visit, people would come through. If you're a medical doctor and you say, I'm open to see patients, I'm telling you, you'll be booked day one. There's such a demand for GPs in Ontario. A lot of them aren't becoming GPs, they're going to become specialists. And that's becoming a problem, because to see a specialist, you first need to see a GP. Not a lot of them, right? So there's that problem. But as a chiropractor, I would tell them to not give up. The first little while is going to be tough. It's not going to be easy. There was days I'd start in my clinic and I'd just be there like this, waiting. And then sometimes people would call me at the worst hours of the night, and I'd have to, and I'd bring my table and my needles, and I'd go treat them, right? And I was like, oh, why aren't they coming to me, right? Because I wasn't in that position. So you're gonna do a lot of things that you didn't think you'd be doing, but it's okay. It'll humble you. It'll make you better. And then those kind of people, those kind of chiros, when they become successful, they're gonna get to that zen, to that point that they're gonna love doing what they do. But I'm gonna tell you that initially it's very tough. I know very many of my colleagues who are no longer chiropractors, and it's sad, because chiropractic college is anywhere from 20 to 25 grand a year, minimum 4 years, right? So what are we looking at already? 100K. And then what if you're not living at home, right? I'm telling you guys, if you guys get to stay home with mommy and daddy, stay home with mommy and daddy. Okay?
I just hired a chiropractor who quit chiropractor, and she's doing a junior safety role for me now.
So
for lots of different reasons, but she wanted out of the field for one of the reasons Anthony mentioned, difficult starting, and the other reason was she wanted to be part of a team. So I think Anthony's he has a team with him, but sometimes you're a lone wolf versus myself. You get to be with people.
It's so true that he said that.
She enjoys people, interacting, dealing with people. So she gave it up. She always has that as a back.
I would say there are a couple of assessment companies where as a chiropractor, doctor, you can go and talk to them, because what we do is we send our clients for assessment, and we get them assessed by different health practitioners, including chiropractor, because we are receiving treatment plans from one chiropractor. We are not sure the information he's providing us is sufficient enough to make a determination that we should go ahead with that treatment plan. So we go ahead and send it for assessment. So there are companies like Direct IME, Sibley's, are all companies, they work with insurance company, but they do work with health professionals. So in that case, if you don't want to be, as Anthony mentioned, lone person, then in that case you can go with that.
I would say for paramedics, as far as getting into the field, it is extremely difficult. It doesn't matter how good you are in school, how well you performed while you were a student. Once you get to the point of hiring, it's a very rigorous process. You need to do a written exam, you need to do a physical exam, you need to do scenarios, you need to do interviews, you need to do lifting testing, you need to do all these kinds of hurdles to be able to get to where you want to be. It is 100% worth it, and keep doing it if this is what you want to do. Like I said, when I graduated from college, it took me a year to get into my job, and that 1 year was the worst year of my whole entire life. It was a standstill for me. It was a waste of a year, because they do the hiring process once a year. So once that process is done, you have to wait a whole year for it to come around again. So it was kind of like, this is where I want to be, but I can't do anything until this time next year when it's starting up again. So I have a friend actually who just got hired also, and she's been out of school for 6 years, just trying to get into the field. So it's definitely very rewarding once you get there. So keep doing it if that's what you want to do, because it is possible, but it's definitely not an easy road for sure.
Any work that came across my table when I first got out of school, I just did it. And so if it was, I worked for an ergonomics consulting company up in Woodbridge, and I didn't want to work there, but I took the job because I needed something. And you just take it and you make the best of it when you're there. I didn't put any extra hours in. It wasn't about the hours you worked, it was about the quality of work and making sure you understood what the expectations were. So I did like really medial grunt work for this company, and I didn't like it, but I did it because you got to build your resume. And so if you want to get to a certain level, without a designation, with maybe just to in the insurance field or my field, you really just get experience. Because everybody who I hire now, if they have zero experience or little experience, I look for something. I always look for, was it volunteering, or was it part-time work? Was it in the field? Was it around the field? And for me, it's always, did you try to seek experience somewhere? So the question I always get from people is, well, how do you find that experience? How do you get it? Just take any job that's related to the field, because that job leads to another job, and that job then leads to your real job, and that real job is where you want to get to. But it may take 4 years to get there, but just take work at a job. And so all of a sudden, Anthony asked me before, how did you get to where you got to? And I said, one job leads to the next job, and all of a sudden you're like, oh, I'm actually really enjoying this, and then it opens up. Then you have 5 years of experience, and then you go, okay, I can get that next job. So just take a job. And don't go, you know what, I really want $60,000. Well, guess what? They're not out there right away. But get a job first.
I think you learn those transferable skills, which are very important. So, it's definitely, this is where you want to be, but you have to start here. And along the way, when you're going forward, first of all, you're gaining knowledge. So you're learning new things that you can utilize when you come here. Because in order for you to be here, you need to know what's happening over here. So when you go there, that's one thing, you have knowledge, you have experience, and you have transferable skills. So now when you're looking at the picture, you're looking at the whole picture. You're not just looking at one aspect of it, because you have already been through different positions. So I guess that's one thing to consider.
Mm-hmm. It's also really important to not expect that you're going to get a job straight out. And if you do, congratulations, that's fantastic. But if you don't, that's okay too. In cardiac rehab, I didn't want to go to university. I wanted to be a paramedic when I was 12 years old. And my mom and I had fights from the time I was 12 years old until I graduated from university, because I didn't want to be here. But that being said, if this goes on tape, it's going to be really bad. My mother was right. I did learn a lot while I was here, obviously, and it got me my job in cardiac rehab. And while cardiac rehab was more of a stepping stone for me, it's still a job that I maintain, and it's still a job that I enjoy working at. But my ultimate goal still was paramedic. Cardiac rehab, I got really good at taking blood pressures and heart rates, so that when I started in the paramedic program, I was really good at that. I was teaching the other students how to do that when we were in our beginning courses. It's definitely something to build on, right? So every experience that you have is going to be, like you said, bigger in the bigger picture.
So my experience at York was amazing. Talking about the overall person, I met some fantastic friends who we still keep in touch with today. Me and you'll actually go probably once a month for lunch, just meeting throughout our day. But York is a stepping stone for that next where you want to go. And like you had said, how you value it, the more you put into it. So when I mean that, unfortunately, it's your grades. The better your grades are, the bigger that stepping stone, right? Because it makes you more competitive. Not so high grades, the smaller the stepping stone. Not to say that you can't achieve it, that's not true, but when you're applying to other schools, that does become a factor. What was told to me by somebody who was a mentor to me while I was at York is he said, think of your time in university like a job. If you put in the time like a job, 9 to 5 during the day, and then Saturday and Sunday you're relaxed, you'll be successful. He's now gone on and he's an orthopedic surgeon. So that piece of advice stuck with me, and if it helps anybody in here, that's good. Why did I want to be a chiropractor? So going into university, I always wanted to be a doctor, but it was like everybody, right?
I didn't.
No, you didn't? No? But you see with experience that the reality sets in, that not every job, as much as you think that it's amazing, there's going to be some aspects of it that you're not going to like. So I'll give you a perfect example. I was a supply teacher from 99 to 04, okay? I made amazing money part-time as a student. So I thought that, this was a great opportunity, but I always wanted to be a doctor. So then what happened was I applied to some schools, okay? And around that time I applied, a vice principal asked me for my resume because he wanted to hire me as a teacher. And I said, well, unfortunately, I'm unqualified because I was an unqualified supply teacher. But a light went in and went, like this gentleman, who I respected very much, wanted to hire me, and I didn't even have the credentials to do it. So I thought that I was good at that, that there was something for me maybe in teaching to actually start to pursue that. So when I applied to Teachers College here at York, which at the time, I'm pretty sure it still is, it had an interview process, which was very, very important to hiring to boards and to principals and vice principals, because the people who accepted you got to see you. They didn't just get to see paper, right? So I got accepted. So I go through Teachers College, and then I fell ill. I got sick, and it was enough to knock me out of school for about a month and a half. And it was during that time that I got sick, being involved in the profession that I thought I wanted to go in medicine, I kind of got turned off. That's just me. So now I was here going, now what do I do? Well, I still had teaching. I love teaching. You give me 30 kids, 4 walls. I love it. But while I was in Teachers College, it was the politics of Teachers College and of that profession that kind of didn't sit with me the right way. So like I said, the actual job of being a teacher, I love it. And still to this day, as a father, as a business owner, as a professional, I still have some contacts in the teaching profession who are now principals and vice principals that I'll call them and I'll say, this day I'm going to book off. Can you call me in if you guys need a supply? And I'll go in just to feed that part of me that still likes to be in the classroom. Okay, so I'm very blessed that way that I can do that. But back to what I was talking about, why I want to be a chiropractor. So I get sick, and I realize that I don't want to go along the medicine stream. So I actually stopped that. And then a friend of mine had said, I'm going to apply to chiropractic college. And I knew nothing about it. I knew nothing about the profession. But he had spoken so highly of the chiropractor who treated him. He loved him. If someone gave him a diagnosis or a problem, he'd say, oh, okay, thank you. And then the first person he used to go see was his chiropractor. And if the chiropractor confirmed it, then he'd be like, okay, I'll go ahead and whatever the case was. So I really, really loved that, right? And I thought that as a chiropractor, I could do both. I could help people when in their time of need, and I could also teach them. So it also fueled that fire in me as well. So it's because of that reason I applied to chiropractic college, and it's kind of fate too. I received my acceptance on my birthday, and I received my license on my birthday 5 years later. So like everything starts to fall into place, and I'm sure it will for all of you too. So where you think you're going might not be it, which is fine, because that's the beauty about life. It's full of surprises.
How did you get into like the cardio rehab? Like how did you like find that position?
Like I said, we did the course here, the psychology of heart diseases. I don't know if it's still here or not, but that sort of talked a little bit about cardiac rehab, and so that kind of put the idea in my head that maybe this was something that I wanted to do. And from that point, I went home and I kind of researched it a little bit, looked it up, found out that the hospital near my house had a cardiac rehab clinic. And I sort of went in and said, hi, I'm a kin student, could I volunteer? They had a whole volunteer process, so I had to go and interview at the hospital and all that kind of stuff. And then from there, I just got hired and they trained me, and when I was just about to graduate, they hired me on. So I volunteered for maybe 3 months and then started working once I finished. Because I'm also a paramedic in the clinic, I'm categorized as a kinesiologist, but I am working as a healthcare provider, which is just a little bit of a higher designation. So I don't need to be a part of the college, and I don't work there enough to be registered as a kin. So you need to look into getting registered as a kinesiologist and make sure that you're taking here are the courses that you need to be able to get in. When it was just OCA, when you just had to be part of the Kinesiology Association, if you were in, I don't know if is it still 2 streams where you have the arts and the science kin? Mm-hmm. So with the arts kin, they didn't let you take enough of the right courses, or they didn't make you take enough of the right courses to be able to be registered. So you couldn't join OCA. So at a few points in my life, I was going to come back here and do more courses to be able to be registered or certified as a kinesiologist. So make sure you look up that and make sure that that you're taking the right courses to be able to be registered, if that's something that you want to do. And that's actually a really good question. I was hoping it was going to come up at some point, because that was one thing that was really frustrating for me about being here, was that once I got to a point in my life where I needed to be certified or I needed to be registered, I couldn't. So it's really important to look into that.
In my clinic, we depend a lot on extended healthcare benefits. So you could be a kinesiologist graduating in arts and science, but if we can't submit your work to an insurance company to get reimbursed, the reality of the situation, you could be the best kinesiology in the country, but if no one's going to pay you $1 for it, you're not. It's not feasible.
You're also insured being part of the college. You have your liability insurance.
Exactly.
So they won't let you work without that.
Don't look at those type of initial costs, because if you're serious about it, and you can make a living from it, right? You get to write them off anyway, so don't worry about it.
I know you said that your type of work has a lot of business involved with it.
Yes.
I'm saying, would you say it would be kind of beneficial to take either some business courses as well, or you could do like a joint program or something in your undergrad to help you?
So I come from a family of entrepreneurs. So my belief is that you want to learn business, you got to get thrown into the fire. No business course is going to teach you to deal with somebody who wants to pay you half of what you're worth, right? So you can. I mean, it's not going to hurt. Any type of education is good. I mean, I don't think it's necessary per se.
I would say the first one would be a people person.
I was going to say that.
Because
Exactly.
at the end of the day, any business you go into, you're dealing with people.
Mm-hmm.
Whether that would be insurance, as a paramedics or as a OT or as a kin. That's the main thing. Also, I think customer service is also goes hand in hand with becoming a people person. So those are main skills. And then rest of the skills you're going to learn in your educational program, as well as any other jobs that you're doing. For me, how the sales thing came up is when I was in college, while I was completing my diploma. At that time, I was doing part-time sales job in one of the insurance companies. So that's how I came across. So I think any kind of job you're doing, there's no small jobs. Anything you're doing, you're learning something out of that. Just utilize that when you go to the next step.
Be adaptable. And so what I mean by that is if you're applying for a certain job in your kin and you want to get into OT or you want to get into insurance, whatever, make sure you adapt your resume, your conversation, your communication to insurance. It takes time, it takes effort, it takes work to do that. But I interview so many people and they can't communicate properly. In health, occupational safety in a workplace is about communication, it's about education, it's about awareness. You've got to be able to do that. So we turn all these people away who have great credentials, great functional skills, but can't be adaptable in certain workplaces. So one thing as a kin, we're all fairly adaptable. A wide range of jobs here. I have friends who are teachers. I have friends who are out of kin, doing all kinds of things. And so you got to be adaptable. And so don't just take a certain, don't pigeonhole yourself. And I have my physical skills, my clinical skills, and you can't do anything else. Because workplaces need other things. We need you to be a full range have a full range of skills. So be a jack of all trades, and be really good at one thing. Like I'm really good at assessing something and knowing what's wrong really quickly, right? But so I rely on that. Then I rely on all my. But then you have to be able to listen. People don't listen. When they don't listen, they don't hear. When they don't hear, they can't fix it. And then when you recommend something, the person's like, well, that's not what I wanted. I didn't want that. I wanted you to listen, then hear what I'm saying. So adaptability is very important. Make sure you're adaptable to what you're applying for, what you're looking for.
So on the flip side, just to add to Neil, he said the big thing is listen, which is absolutely true. The flip side of listening is to be able to communicate. And so in university, I think it's really important to be able to communicate. So these papers you have to write, test, whatever, communicate, really put down exactly what you're thinking and get that point across. So just to elaborate on that, in the insurance field, if she's dealing with a client who she's unfortunately had to deny their benefit, right? And the person's going to be yelling, why'd you deny my benefit, this and that, right? She has to communicate and be reasonable and rationalize to the person on why.
Yeah.
Right? Yeah.
Yes.
So I have to be the
It's a
mediator.
big
I have to
one.
be the mediator with this all the time. Why did they deny my claim? Because they denied the claim for this, and reason, right? So communication is key. So you learn that during writing papers and tests and so on, and just interacting with professors and your colleagues.
And also, a piece of advice that I got while I was here, I don't know if Merv Mosher is still a professor here, because he's awesome. Okay.
Is he still here?
So maybe he told you. Maybe he told you already. I don't know. He told our class to go and interview. Interview for jobs that you have no interest in doing. Interview for everything. Go and practice interviewing, because once you get to that point where I just got goosebumps, where you get to the job that you actually really, really, really want, you are comfortable, you're confident, and you know where the interview process is going, and you know how to interview, because that's really, really important. I've done a million interviews, and for millions of stupid jobs that I did not want, but I got to where I wanted to be.
People skills are important, and what better way than joining a club or getting involved on campus and being involved with other people and learning to work and interact and problem solve with other people, and there's so many great leadership opportunities too. So that's great advice. So that brings us to the end of our formal Q&A session.